Hello and welcome all of you to yet another episode of Meet the Masters. Today the Medibus TV camera crew is at the premises of Saudi German Hospital, Dubai, and I am in conversation with their CEO, Dr. Reem Osman. Hello and welcome to the show.
Hello.
Well, a son is a son until he gets a wife, but a daughter is a daughter for life. And today I am in conversation with a daughter, a woman of true sense, the CEO of Saudi German Hospital. Welcome once again.
Thank you very much. Welcome. Thank you for having me.
Yeah. My first question is, tell us something about the Saudi German Hospital group as a whole.
Our group is one of the largest healthcare group in the Middle East. We are now 25 years old. We have 4 tertiary hospitals in Saudi Arabia. The group started 25 years ago. First hospital in Jeddah, and then they decided to expand. The other hospital was in Riyadh, Medina, Al Munawwara, and Asir. And then after that, it was the second phase of the group about the regional expansion.
Fine.
So in 2006, it was the inauguration of Saudi German Hospital Sana'a in Yemen, and 2 years ago, it was our inauguration, Saudi German Hospital Dubai. Still the group in the expansion phase and proving itself whether from the healthcare services it's providing and the location, the quality of staff as one of the major player in healthcare in the region.
Tell us something about yourself. We would like to know about yourself.
I'm Reem Osman. I'm a doctor ophthalmologist. I have master degree in ophthalmology, and I have also master of business administration. I'm originally from Syria. I studied my medicine and master in ophthalmology from there. And then I moved to Saudi Arabia to practice as a doctor. After that, I came here to Dubai, and it was the decision that I want to move to the business part and the management part of healthcare. So I decided to take a master of business administration. And I found my passion is in the management and the satisfying or achieving and solving the problems and the challenges that we having in healthcare. So I was dedicated to healthcare management since now 5 years.
Well, what is the speciality of Saudi German Hospital here in this part of the world in Dubai?
Okay, our group in general, let me talk about the group. What's the name? I will talk about the group, why the name Saudi German? To start off, Saudi German is coming as our owner and the founder, Mr. Subhi Batarji, and his co-founder, Dr. Khalid Batarji, his brother. They are, of course, Saudi, and the company who started up and built the hospital is Saudi company. So the management and the medical management, the doctors, the medical equipment, it's all German made. And also, of course, we have very active German visiting professors in Saudi Arabia, and we started it in Dubai here, and we have good relationship with German universities, medical universities. So that's the name came from. Our portfolio, or as a group, we are only into tertiary hospital and tertiary services. So you will see all specialties available and subspecialty, and all the difficult and complicated cases will be done in our hospitals. Many cases, although we are only 2 years now in the market, but many cases, surgical cases were done here, which was like first time in UAE or first time even in the Middle East. We have one maxillofacial case was done. It was first time in the world. The professor came from France and did the case. We did 2 years ago the second quintuplet delivery in the UAE. So it's in the UAE history. It was the second quintuplet delivery. It was done in Saudi German Hospital, Dubai. So because of our standard and of our capabilities and the team, we always work into having challenges in our medical practices. We are our size and our experience force us for this, and people expectation. My vision to the hospital here is one-stop shop. So I don't want the patient to come in his sickness and then I tell him to go other place to do this test or maybe the surgery, I can't do it. I think that the patient must come in a hospital this level that he should be served from A to Z. That's why all services are available in the hospital or subspecialty. And one of the also challenges that we had when you open hospital this size, that you have to be complete from the first day. Your emergency should be open 24/7. Your ICU should be ready and open. Your OT theaters, everything. So you should be ready from the first day because simply people expectations are high and you should meet such expectation. So it was very interesting years to start and thank God we proved ourselves and we proved our reputation and our position in the healthcare market of UAE.
Yeah, you were talking about the quality of equipments, the one-stop shop and so on. But we would like to know about the quality of doctors, the nursing
It's major
staff.
part also. It's always the success. It should be many factors. You have the infrastructure, whether the building and its design and how friendly the design itself. We are as a group, we have our own company to build the hospital. So we are experienced in even building the hospital since 30 years till now.
The competency is already
yeah,
there.
of course. And you developed when you are building by yourself. So you developed. We developed Saudi German Hospital Dubai is much more friendly user, much more modern hospital than maybe our hospital that was built 25 years ago because we are learning from the experience. So this is one part. Also how you have this beautiful building, big rooms, whatever, but how you will equip it also.
Absolutely.
So you have to choose the good medical equipment that will give you accurate diagnosis because without accurate diagnosis you can't do the proper treatment.
Absolutely.
Then after that, okay, the hospital is ready, building medical equipment. Where is the soul of the hospital? The soul of the hospital is coming from the people who are in it, with their administration staff, management staff, and of course the medical staff. So it's all one cycle. Even if you will have the most important doctor in the world, if there is not supporting system around him, he cannot do the surgery.
Absolutely.
Because maybe you have purchasing department not good enough, not bringing for him the equipment or instrument he needs. So it's all one big cycle and everyone are part of it and part of the success and the quality of the services they are providing. I always tell the staff and the message that the quality of the services we are providing is mandatory, that everyone is responsible for our patient. Patient journey started from that time he parked his car till the time coming till time he's leaving, and everyone of the whole staff is responsible, whether from the valet parking who receive him, the security, the housekeeping, and to the surgeon who did his surgery. Also, our doctors, our medical teams, we always depend on diversification and the quality. Good doctors coming, we have almost 32 nationality of all staffs and medical team. We have even 50 spoken language because also patients come here. You are living in Dubai, it's multinational city, 200 nationality available. You have also patients might go, maybe people go to restaurant, know how to order a meal, but when patients is in pain, sometimes it's important for him to speak his own spoken language. So we provide this to our patient, and of course we are responsible and we focus always about the medical background and the competencies of our doctors and the diversifications of the doctors and specialty that they are providing.
Well, in this part of the world where we call Dubai as the new capital of the world, people with multinationality, multi-ethnic and so on, people don't have time for themselves. They are so busy, and the end result, not eating on time, stress and so on. So what are the prerequisites that one should follow in this part of the world, this busy world, to protect the precious thing called health? It is precious, but it's very neglected. So what are the precautions that one should follow? We've heard about no smoking, we've heard about so many other aspects. So we would like to hear from the doctor's stand?
I always, even we are as human beings, we have the same. We are into the management, our work, we are into this busy world between life and family and the work like that. So sometimes even we neglect ourselves, although we are doctors and we are working in a hospital. So it's always for any a person, whether a father, a mother, a manager in a job, regardless, the health is the most important equity that you have, assets that you have. So you have to keep your health, because it's only without health you can't do anything, you can't build anything. So it's always that we have to take care of balance in such a life and such fast life that we work in. It's the balance is the most important between work, between life, and between family, and between serious times and having fun, because balance is the one that will reduce the stress related to life in general, not only to work. So many of the current disease, chronic disease, whether diabetes, high stroke, high blood pressure, whatever, you will see that the stress, it will be major part of its risk factor. Plus, of course, smoking, drinking, the unhealthy life is food habits, it's all practicing sports. This is all this healthy lifestyle. So we should always, people in general, focus on the balance between the work and their family life, and also between work time and rest time, and also the healthy lifestyle. And always remembering we are the most important asset for us, for our family, for our community, for our companies. Some people might work like 14-15 hours to build something, but they can't catch the success, because before they achieve it, they got sick or whatever. So it's always part of balance, and know when to take a break, and know how to educate about ourselves. I think many educational programs now listening, but sometimes even if you are educated, we simply just neglect it. We just make sure that we take care of ourselves and people who are around us.
Well, in this part of the world, that there is another problem that the world is facing is obesity, and people are obese in developed countries like this. So what, according to you, is a balanced diet, and what do you think is prescribed for a healthy health?
Of course, stay away from fast food. Everyone know it. You can maybe once a week, but in general, to talk into more general things, always we are working, and in the hospital itself, whether our dietitian department, we have obesity related department, because obesity in this part of the world, especially Gulf area, is very high. And of course, obesity come, diabetes will come, hypertension will come, depression, not only depression will come, and many social related problem. We have our obesity department that provide dietitian advices and consultation, and you'll be surprised that many people doesn't know it. Good food doesn't mean it's healthy, and the ugly food tasty. Healthy food doesn't mean untasty food. You can do tasty food, and you can eat everything, but in the moderate sizes. So it's moderate life. It's always important factor for us. Plus this, if you're not able to lose your weight with only diet or whatever, now the surgeries is available also for all obese people. Many people who did this obesity surgeries got cured from obesity after it. Their blood pressure returned to normal. And actually we will have some cases here in the hospital. Will tell you, we live again. We have now a new life.
Rebirth
after the rebirth. After now we can live, we can wear proper clothes, we can enjoy our life.
Well, tell us something about your CSR activities in this part of the world.
As part of me, as my vision as a CEO, or my vision and strategy to lead the hospital, it's always, I think, hospital work on my work depend on 3 roads, if you can't, or plans. So first one, you have your responsibility towards your patient, to give them the best services and treat them well. You have your responsibility toward your staff and the medical education, and make sure that they are always updated, because educated, updated staff will will give proper services to your patient. And also in the hospital, we focus on the community around us. So we do a lot of corporate social responsibility events. We are very active into awareness campaigns, into outreach programs. Not all the employees, people got, as you said, busy life. People got stuck in their companies. They will say no need to go and make some routine blood sugar test or blood pressure test. So we go, my staff, we have a special team only dedicated for such awareness and outreach program. They go to the companies, they see the whole staff, and they did for them simple tests like cholesterol, blood pressure, blood sugar. The dietitian will go and give full advices to anyone who want any question. Maybe dermatologist will go, maybe internal medicine. Sometimes the emergency doctor will go and give many advices about some small things for first aids. So we don't only depend about people to come to us. We don't only depend about sick people who will come to us, but we go to the healthy people and we give them many small, no need to give long boring lectures. People might not focus. No, but we give some small tips, some small examinations, and some small brochures that people, at least in their busy life, they will have time to read it and look at it. Information and how to educate themselves and their family. Besides this, we are very active as a hospital in our educational programs for our medical staff and Dubai medical staff. Every month we do events. This month we finished our second international conference about acute medicine and emergency, and there was 400 attendees from mainly 90% of them from outside the hospital, other surrounding hospitals. We have speakers came from USA and from Germany, and it was very successful like that. So always continuous education for medical staff is very important. We are the only private hospital whom we have agreement with Dubai Ambulance. Okay. We receive trauma cases and accident cases. So, and we cover this part because of our geographic location. We cover this part of Dubai for the trauma and accident, and we are working. Absolutely. We always believe in cooperation between the regulators, between the government hospital and the private hospital to develop and upgrade the healthcare. Many advices they give to me, maybe the regulators when I meet them, or Dubai Ambulance, and many also advices because of our daily practice here we give to them, and we have always these discussions. Always our aim on how you want to improve the healthcare sector in Dubai. Absolutely. You should not only look into your business as single business unit, and this is what you have, your profit, your loss. It's not only like that. You should look into the community itself, into the industry itself, Absolutely. And to work how to improve it, because the improvement of the healthcare sector, whether from regulations point of view, whether from policies, licensing, whatever, it will give improve the sector itself, and then it will give the positive result to your business institution itself. We are also very active into the medical tourism. You know now Dubai itself, with the orders of His Highness Sheikh Mohammed bin Rashid Al Maktoum, to become the hub for medical tourism in the world. So we are very active in this one about regulating it, about when to start. We want to start it in the proper way. We are already attracting many patients as from surrounding country, other Gulf country, Russia, African countries, medical tourism, and we want also to improve it, because we don't see anything that should stay as a burden in front of Dubai in this journey. Dubai proved itself in the tourism in general, and medical tourism is one part of the tourism. I see the infrastructure is available, very good hospitals, private and government, very good doctors. Dubai can attract a lot of big star names in medicines, so patients will follow.
What are the different activities or awareness programs or social responsibility cost activities that the Saudi German Hospital conducts for women and children in this part of the world?
Yeah. As I mentioned, we do a lot of outreach program, awareness campaign. Part of it are for employees, and also the other part we do a lot for the family itself, for the mothers and for their children, of course. Many of the events here you will have a lot of you can call it like conferences, which is for the woman, which is not only health related, but maybe it will have health, fashion, food related. So we always sponsor the health part of it. You'll see like 500 ladies will come. We give them a lot of advices, awareness, brochures. You will see that many things you have to, sometimes it's life-saving, especially before last year we did one of the campaign about first aids. And we have auditorium in the hospital that will fit 400 guests. We did awareness about first aid at home. You will discover that even for me as a mother sometimes, that maybe mothers, or if they are working, they will keep their children with the nannies. Sometimes if that child was eating something and got shock of it, what will happen? You'll know that its saving procedure is very easy and simple, and it will save the life. If there is some burn, what's the first aid? Because always the first steps, how you do it, till you call ambulance, until ambulance come, it will take time. And so small education. We did even BLS, basic life support training for mothers and for the nannies, and I really recommend all families. Sometimes we leave our children with their grandmother. You don't know, sometimes small things might let us lose our children. So I are even focusing on this, that basic life support training is done for all medical staff and nurses, and it's very easy, one-day workshop, and I recommend that even every mother should do it. Even for her or her nanny. I did it for my own nannies. So I'll be comfortable if anything happened to my children or to my mother. She's sitting with us. If there is any also elderly people, the nannies themselves can at least act. So this is part of some education that we do for the woman and family in general. Some awareness, like summer is coming, how to take care, the sun, protection from the sun, how you provide the importance of the healthy lifestyle, that how you teach your children on the healthy food, they will grow up and they will be used to it. It's depending always, as they say, obese children are obese adults. So it's major problem here in these areas are obesity. How you teach your children since they are 1 year and 2 years and 4 years old about the healthy lifestyle, they will grow up like that, and at least in the future you will guarantee to have generations with less obesity.
Absolutely. And lastly, one last message, if you would like to give to the youngsters, or basically to children, women, irrespective of the gender, to the Homo sapien community as a whole. What is that one message that you would like to pass on in terms of healthcare?
In terms of healthcare and business in healthcare in general, my message for me, because as a mother, as a wife, as a family, and also as a CEO, it's a lot of maybe complicated tasks.
Responsibilities also.
Yeah, and responsibility. How I'll manage it? Many people ask me this question: how you manage it? It's always, as I said in the beginning, it's about the balance. How you make the balance between your work and your life.
Because between your professional and personal life.
Of course. At the passion that you have it, you should have the passion for your work also, so to be successful in it and to commit it to it. Many of the messages that I give it to my staff, when they will see their CEO how passionate for her work, also they are committed and passionate for their work. When they see me believe in the vision of the hospital, working for to prove that the SGH Dubai, and that's why even one of the major reasons about the fast success that we achieve it within 2 years in Dubai. Within 2 years, we proved ourselves as one of the major healthcare player in not only Dubai but UAE, alhamdulillah. So this is part of how you are passionate and committed toward your work, you and all your staff who will follow your vision. For all the young ladies and people who, I don't think there is, in this modern life, I see there is no barriers. you can achieve everything and you can be successful in everything and you can take care of everything when you have the balance and also when you have the commitment and when you invest in yourself. So it's always, I think sky is the limit for everyone now. This online education, living in Dubai, that has a lot of business opportunity. I recommend everyone. I studied my master of business administration while after marriage, while I'll have children, but because I have dream and I wanted to achieve it. So there is no barrier. We can achieve whatever we want. We can study whether from home or from university, full-time or part-time. And we can achieve the success and for us and for our family, and we can be good example for our children also, because when the children will see us as successful and role model for them, they will be part of this and they want to be like us. I think that especially for the woman, when they ask me about women empowerment and women in leadership positions and balance between this, I think that women can achieve it all, and in a very friendly environment and very woman-friendly environment. Like Dubai city, I think there is no excuses for women not to be CEOs and managers and leaders, whether in healthcare or in business or in any category you want it.
Thank you very much for your valuable time. And
Thank you.
I would like to wind up the interview statement by saying that a leader will say, we go, but a true leader says, let's all go together. And you're one of them.
Thank you.
Thank you
Thank you
very
very
much.
much.
Thank you.
Thank you.